Pediatric neurology is the practice of medicine for children with neurological differences. My name is Dr. Britton Zuccarelli, child neurologist at Salina Regional Health Center's Salina Pediatric Care.
Well, Dr. Zuccarelli, thank you so much for joining me today. We're going to be talking about pediatric neurology. So what do you do as a pediatric neurologist?
Thanks, Mike, for inviting me. So a pediatric neurologist is a pediatrician trained to take care of neurological conditions that affect children. The majority of patients that I see are children that have conditions like migraine headaches or seizures from epilepsy, but I also see children who have developmental delays, difficulty with ADHD symptoms, autism, neuromuscular conditions, and really anything that can affect the nervous system as they're growing and developing.
Let's take a look at one of those conditions, epilepsy, and kind of take us through what you do for the patient and also if you're doing different services within the hospital for that patient.
Sure. So epilepsy is when a child has recurrent seizures for no apparent reason. So at first we try to rule out any cause for the seizures. And then we try to figure out if exactly what the child is doing is an epileptic seizure or not. So after taking a careful history and physical examination, then we might send the child for a test called an EEG or an electroencephalogram, where they have wires connected to their head that are then connected to a computer and measure the brain electricity. And that's done in our non-invasive department at Salina Regional. With those results, sometimes we end up taking pictures of the brain, like maybe with an MRI scan or a CT scan in our radiology department. That can let us know if there's maybe a structural cause for the abnormal electricity that might be causing a seizure. Sometimes children need to have laboratory tests done, blood tests, urine tests, genetic testing even, to try to figure out why the seizures are happening. And then we try to treat the epilepsy symptoms with medication, diet changes. So sometimes we involve our dietitians, and other times we have to treat with surgery. And so sometimes we have our surgical colleagues help take care of these patients.
I know you also have some outreach clinics. Where all are you going as well?
Every Friday we travel. So we go to Manhattan, Kansas, Heston, Russell, and Concordia.
If a parent has a concern regarding their child, obviously you work with the other pediatricians, but I assume they can call you directly or talk to their pediatrician?
Yes, so the majority of my patients are sent to me by referral, and sometimes that starts with a conversation with the pediatrician or family doctor, a worry they might have about the patient. Sometimes the parents call us directly, and we do encourage them to talk to their doctor first to see if a referral is appropriate.
Well, thank you so much for some great information, and thank you for watching. For more information, please visit salinapediatriccare.com and like Salina Regional Health Center on Facebook. Follow us on Twitter and Instagram.